Hi, I'm Dr. Ryan Westbrook, and today I want to talk about something that affects millions of people but often goes unnoticed until it becomes a serious problem: poor circulation in the legs. You might be wondering, why should I care about leg circulation? Well, the truth is, your legs are constantly sending you signals. They're trying to tell you when something's wrong, and poor circulation is one of those sneaky conditions that whispers before it screams. The earlier you catch it, the better your outcomes will be. Over my years in clinical practice, I've seen patients come in with severe circulation problems who said the same thing. I didn't realize what was happening. I just thought it was normal aging, but it's not. And that's exactly why I'm making this video today. Let's start with the basics. Your circulatory system is essentially a delivery network. Your heart pumps blood out through arteries to nourish every cell in your body. That blood carries oxygen and nutrients. Then it returns to your heart through veins. It's a complete loop. When this system works well, you feel energized. Your legs feel strong. You can walk, climb stairs, and chase your grandkids without thinking about it. But when circulation starts to deteriorate, your legs don't get the oxygen and nutrients they need. The waste products that should be removed start building up, and your body begins showing signs. Not all at once, usually gradually, which is why so many people miss the warning signs. Poor leg circulation can happen for different reasons. Some of it's about your arteries narrowing due to plaque buildup. That's called peripheral artery disease. Some of it's about your veins not pumping blood back up effectively. That's venous insufficiency. And sometimes it's a combination of both. But regardless of the cause, your legs will give you signs. You just need to know what to look for. Let me walk you through the most common symptoms I see in my practice. And I want to be clear. If you're experiencing even one or two of these consistently, it's worth talking to your doctor about. You don't need to wait for all of them to show up. The first symptom is leg pain with activity. This is what we call claudication. Basically, you're walking or climbing stairs and your calf starts to ache. It's not a sharp pain usually, it's more of a cramping sensation. Your leg feels tired, almost like you've worked it hard at the gym, except you haven't. The interesting thing about claudication is that it's reproducible. If you walk a certain distance, the pain happens predictably. You stop, rest for a few minutes, and it goes away. Then if you walk that same distance again, it comes back. I had a patient, Margaret, who came in complaining about this. She said she could walk to the mailbox at the end of her driveway, but then her calf would cramp so badly she'd have to sit down. She thought she was just getting older and less fit. Turns out her femoral artery was significantly narrowed. Once we diagnosed it, we could help her. The second symptom is heaviness or fatigue in the legs. This is different from just being tired. Your legs feel weighted down, heavy, like someone put a sandbag on them. You might notice this especially at the end of the day or after you've been standing or walking. This happens because the muscles in your legs aren't getting enough oxygen. When muscles don't get adequate oxygen, they fatigue quickly and feel heavy. The third symptom is numbness or tingling in your legs and feet. Now, there are many causes of this, but poor circulation is definitely one. When blood flow is compromised, nerves don't get the signals they need to function properly. You might notice this as a pins and needles sensation, or your feet might feel numb like they've fallen asleep. Some people describe it as their feet feeling tingly or burning. The fourth symptom is coldness in your legs or feet. And I mean coldness that doesn't match the temperature around you. Your partner might be comfortable in the room, but your feet feel ice cold. This happens because blood carries heat. When circulation is poor, less blood reaches your extremities, so they're literally colder. I often have patients tell me their feet are always cold, and they never realized it was a circulation issue. Let me tell you about Tom. Tom came in complaining that his feet were always cold. He'd wear thick socks to bed, and his wife complained because his feet would be like ice cubes. Turns out, his circulation was compromised. Once we started treatment, within a few weeks, his feet warmed up. His wife was actually shocked. The fifth symptom is skin color changes. This one's important to notice. In healthy circulation, your skin has a pinkish tone. When you press on your skin and release, the color comes back quickly. But with poor circulation, you might notice your legs look pale or even slightly bluish, especially your feet. Or you might notice that when your legs are down, they turn a reddish or purplish color. This is because the blood is pooling. Some people also notice that when they lie down and elevate their legs, the color drains and they look pale. The sixth symptom is shiny skin or lack of hair on your legs. This is subtle, but it matters. When circulation is poor for an extended time, the skin can start to look thin and shiny. You might also notice that the hair on your leg starts thinning or disappearing. This happens because hair follicles need good blood supply to stay healthy. When blood flow decreases, they don't get what they need, and hair growth slows or stops. The seventh symptom is slow healing cuts or sores. And this is a significant one because it can lead to serious complications. When you have poor circulation and you get a cut on your leg or foot, it takes much longer to heal. The cells that repair wounds need oxygen and nutrients, and if they're not getting adequate blood supply, healing is delayed. I've seen minor cuts that should heal in a week take months, and worse, they can get infected more easily. The eighth symptom is toenail changes. Your toenails might become thick and brittle. They might crack easily, or they might grow more slowly than usual. Again, this is because the nail beds need good circulation. Without it, they don't function optimally. The ninth symptom is muscle weakness in your legs. Not the kind of weakness from sitting on the couch too long. I'm talking about genuine weakness where climbing stairs becomes difficult, or you notice your legs just don't feel as strong. This happens because muscles need oxygen to function, and poor circulation means less oxygen reaching your leg muscles. The 10th symptom is cramping, especially at night. Some people experience leg cramps at night that can wake them up. These cramps can be painful, and they happen because the muscles aren't getting adequate blood supply, especially when you're at rest. Now, here's something really important. The location of your symptoms can give your doctor clues about where the circulation problem is. If you're having pain in your calves, that often suggests a problem in the arteries below the knee. If the pain is in your thighs or buttocks, that usually points to a problem higher up, in the femoral or iliac arteries. Pain that goes across both legs equally might suggest a different issue than pain in just one leg. One-sided pain often points to a blockage on that side, while bilateral pain might indicate something more systemic. Let me talk about risk factors for a moment, because understanding these can help you assess your own situation. Age is a factor. As we get older, our arteries naturally become less elastic. Plaque buildup happens more easily. So poor circulation becomes more common as we age. Smoking is probably the biggest modifiable risk factor. Smoking damages your blood vessel linings and increases plaque formation dramatically. If you smoke and you're experiencing leg symptoms, this is especially important. Diabetes increases your risk significantly. High blood sugar damages blood vessels over time. I always counsel my diabetic patients to pay close attention to their leg symptoms. High blood pressure and high cholesterol both increase your risk. These conditions damage the inner lining of your blood vessels, making them more susceptible to plaque buildup. Being sedentary increases your risk. Regular movement helps maintain healthy circulation. When you sit all day, circulation naturally decreases. Obesity is a risk factor because extra weight means your heart has to work harder to pump blood to all that tissue. Family history matters too. If your parents or grandparents had circulation problems, your risk is higher. So what should you do if you're experiencing these symptoms? First, don't panic. But do take action. See your doctor. Seriously, if you're noticing one or more of these symptoms, schedule an appointment. Poor circulation is very treatable when caught early. Your doctor will likely start with some questions about your symptoms, how long you've had them, and whether they're getting worse. Your doctor might do a physical exam. They'll check your pulses in your legs and feet. They'll look at the color of your skin. They might check for swelling or sores. They'll also listen to your arteries with a stethoscope to see if there are any unusual sounds that might indicate narrowing. Depending on what they find, they might order some tests. An ultrasound can show how blood is flowing through your arteries and veins. It's painless and takes about 20 minutes. An ankle brachial index test compares blood pressure in your ankles to blood pressure in your arms to assess circulation. Sometimes a CT or MRI scan is needed to get a clearer picture. While you're waiting for your appointment or even after you've been diagnosed, there are things you can do to help improve your circulation. Walk. This is one of the most powerful things you can do. Walking gets your leg muscles working. When muscles work, they pump blood more effectively. They improve circulation naturally. Start with short distances if you're in pain, but walk regularly. 5 to 10 minutes a few times a day is better than a long walk that causes severe pain. Elevate your legs when you're resting. This helps blood return to your heart more easily, especially if venous insufficiency is part of your problem. When you sit, Try to keep your legs elevated at or above heart level. Avoid crossing your legs. I know it's a habit, but when you cross your legs, you can restrict blood flow. Keep them uncrossed or use a pillow to support them. Stay hydrated. Dehydration makes your blood thicker, which makes it harder to circulate. Drink plenty of water throughout the day. Avoid prolonged sitting. If your job involves sitting all day, get up and move for a few minutes every hour. A short walk around the office or even just standing and stretching helps. Keep your feet clean and inspect them regularly. With poor circulation, infections can become serious quickly. Check your feet every day for cuts, sores, or changes. Keep them clean and moisturized, but avoid getting them too wet. Wear compression socks if your doctor recommends them. These gradually compress your legs, helping push blood back up toward your heart. They can really help with swelling and heaviness. Manage your other health conditions. If you have diabetes, keep your blood sugar controlled. If you have high blood pressure, take your medications and follow dietary recommendations. These conditions worsen circulation, so controlling them helps. Maintain a healthy diet. Foods rich in fiber and low in saturated fat support healthy blood vessels. Antioxidants found in colorful fruits and vegetables help protect blood vessel lining. Consider the Mediterranean diet, which has strong evidence for cardiovascular health. Stay physically active overall. Beyond walking, regular activity helps maintain good circulation throughout your body. Even gentle activities like swimming or cycling can help. If you smoke, quit. I can't overstate how important this is. Smoking is one of the most damaging things you can do to your circulation. Quitting is the single best thing you can do for your vascular health. Manage stress. Stress increases blood pressure and can worsen circulation issues. Find activities that help you relax. Meditation, yoga, deep breathing, spending time in nature. Whatever works for you. Sleep well. During sleep, your body repairs itself, including your blood vessels. Aim for 7 to 9 hours a night. Now, let me talk about when you really need to see a doctor urgently. These are warning signs that indicate a more serious problem. If you develop an open sore or ulcer on your leg or foot that won't heal, that's urgent. Poor circulation can lead to serious infections when wounds don't heal properly. If you notice sudden severe pain in your leg, especially if one leg is suddenly much worse than the other, that could indicate a blood clot or acute arterial blockage. This needs immediate attention. If you notice sudden weakness or paralysis in one leg, seek care immediately. If you develop signs of infection like fever, increasing redness, warmth, or pus from a wound, that's urgent. If your feet or legs suddenly become very cold or turn a bluish color, that needs attention. Let me address something important that I see a lot. Many people, especially seniors, assume that poor circulation is just part of aging and there's nothing to be done about it. That's simply not true. There are many effective treatments available. Some are lifestyle-based, which I've described. Some involve medications that improve blood flow or reduce clotting risk. Some involve procedures where doctors can open blocked arteries. Some involve other interventions. The key is getting diagnosed so you can get treatment appropriate for your specific situation. I've seen patients who were told they'd need amputation because their circulation was so poor. But with proper intervention, we prevented that. I've seen patients who couldn't walk more than half a block who now walk miles. Treatment works when it's started. Here's what I want you to take away from this video. First, pay attention to your legs. They're telling you important information. Second, if you notice any of these symptoms, don't dismiss them as normal aging. They're not. See your doctor. Third, take action. Whether it's making lifestyle changes or getting treatment, there are things that work. And finally, remember that early intervention gives you the best outcomes. The earlier you catch poor circulation, the more options you have, and the better your long-term health will be. Your legs have carried you through your entire life. They deserve good blood flow. They deserve attention. And you deserve to feel strong and capable for as long as possible. If this video was helpful, please like it, subscribe to the channel, and share it with anyone you know who might be experiencing leg symptoms. Ask your questions in the comments, and I'll do my best to answer them. If you need medical care, please reach out to your healthcare provider. I'm Dr. Ryan Westbrook, and I'll see you in the next video.